One has to twist one's neck to see Pratima properly.
I just decided I won't put on my video.
Priyansh, you can start, I think. So others
Okay.
will join. Yeah.
Okay, shall I? I'll start, sir, then.
Yes, please. Yes, please.
Good evening, everyone. Myself, Dr. Bhavneesh Saini. I'm an assistant professor.
Meeting there.
Sir, good evening.
Good evening. Good evening.
Good evening, sir.
Good evening.
So, good evening, everyone. Myself, Dr. Bhavneesh Saini. I'm an assistant professor at Guru Gobind Singh Medical College, Faridkot, Punjab. I warmly welcome our respected chief guests and resource persons for the day, Dr. Pratima Murthy ma'am, ex-director NIMHANS and a senior professor of psychiatry, Dr. Sanjeev Jain sir, former senior professor at NIMHANS. I also welcome Dr. Mohan Isaac sir. He's a professor of psychiatry in Australia. I also welcome the IPS office bearers, Dr. TSS Rao, President IPS. He's yet to join. Dr. OP Singh, the Vice President IPS. Dr. Arun V. Marwale, the Honorary General Secretary IPS. Dr. Lakshmi Naresh Parlamani, the Honorary Treasurer IPS. Dr. Sujit Sarkhel, the Editor IJP. Dr. M. Kishore, the Chairperson of the IPS Faculty Development Subcommittee. Members of the ITOP and all faculty members and all participants who have joined. Psychiatry in India has a deep and evolving history, yet much of its documentation remains incomplete and scattered. Every discipline is built on its memory, and how we preserve it shapes how we understand our present and future. This session will explore what we know of our past and what we must do to safeguard it. I now invite my co-moderator, Dr. Priyash Jain, to please take the session forward. Thank you.
Thank you, Dr. Bhavneesh. I'm Dr. Priyash Jain, Assistant Professor, Department of Psychiatry, MJ Medical College, Indore, and editor of Minds Newsletter. On behalf of the organizing team, I warmly welcome you all to this important academic session on archiving of historical documents of psychiatry and psychiatry education in India. I now have the honor of inviting our esteemed office bearers of the Indian Psychiatric Society for the inauguration and the opening remarks. May I first invite Dr. Om Prakash sir, Vice President of the Indian Psychiatric Society, to share his thoughts on the topic.
Good evening, respected teachers. I just welcome Dr. Sanjeev Jain, Dr. Pratima Murthy, Dr. Mohan Isaac, and all others to this program. ITOP has been doing great in terms of medical education, and with IPS faculty development section, this is a great program where history should be documented of medical education. And we again have none other than Professor Sanjeev Jain and Professor Pratima Murthy to enlighten us. So I will not come in between their talk. So thank you. Thank you so much. My regards.
Thank you, sir. Sir, may I now invite Dr. TSS Rao, sir, President of the Indian Psychiatric Society, to kindly address the gathering.
Okay. Sorry for the delay. There was some technical glitch because of which I couldn't join. Are you able to hear me?
Yes,
Okay.
sir.
Okay. See, Indian Psychiatric Society, we are very serious about archival issues. In fact, we have formed a separate committee for this job, wherein my idea was all the programs, many of the documents, and anything of historical importance, everything should be available to anybody and everybody wherever they want to either look into the details, do research, or whatever it is. I'm also aware, now I'm extremely happy that this particular section under Dr. Kishore has taken up. particularly the faculty development aspect. I'm really grateful for this. There are two things. One is documenting each and everything that has actually happened and keeping it at a proper place for the posterity one, and picking up some particular idea and doing research and archiving all the details related to that. And we are all well aware of great work Dr. Sanjeev Jain, Alok Sarin, and quite a few people, other people associated with that, they are doing. I still remember very vividly some of the programs what we conducted, like the past presidents, past editors, the publications of past presidents, and many other such things. Actually, each year we used to carry on certain particular activities. I'm extremely happy that this program is happening, and I am grateful to both Dr. Pratima Murthy, Dr. Sanjeev Jain, who will be the speakers today. We are looking forward to something very important, and whatever help from Indian Psychiatric Society will be available. Very actually, what all the suggestions are available, we'll try to see that it is incorporated. This is my promise as President of Indian Psychiatrists. Thank you very, very much.
Thank you, sir, for your kind words and your commitment to our issue. May I now invite Dr. Arun V. Marwale, sir, Honorary General Secretary, to kindly address us.
Thank you. Respected Dr. T.S.S. Rao, sir, Honorary President of IPS, Honorable Dr. VP, हमेशा VP आता है, O.P. Singh, sir, the President-elect, respected Ma'am Dr. Pratima Murthy ji, Director of NIMHANS and today's resource person, then Professor Dr. Sanjeev Jain, sir, who is again another resource person and who has done a great job in archiving the history of IPS. Honorable Treasurer Dr. Sujit Sarkel, Honorable Editor Dr. Sujit Sarkel, and Treasurer Dr. Naresh Wadlamani, all the other office bearers, EC members, Dr. M. Kishore, the Chairperson of Faculty Development Program of IPS, and committee members, so also the ITOC team members, moderators Dr. P.U. Jain and Bhavesh Saini, and all other participants. A warm welcome to all of you, particularly the participants. I appreciate the presence of today's session on archiving the historical documents of psychiatry and psychiatry education in India. The goal of this session is remembering the glorious history of IPS and keeping it in a safe manner. So it's an Herculean task that way. I congratulate Dr. M. Kishore and his team for accepting this task. I wish all of you best luck. Thank you so much for inviting me.
Thank you so much, sir, for your kind words. May I now request Dr. Lakshmi Naresh Wadlamani, sir, Honorary Treasurer, to share his remarks.
Respected seniors, teachers, my office bearer colleagues, committee members, and other members who have joined from other committees. Indian Psychiatric Society has a great history, and it has a headquarters at Gurgaon, and it has space. So any physical copies of archives can be kept in that headquarters, and it can be referred, cross-reference can be done by anyone for future generations as well. And yes, nowadays the digitized form is also in vogue. I'm sure the committee members will come up with various ideas as to how to archive all these history throughout for the last 70, 80 years of Indian Psychiatric Society. And I wish all of them best of luck. Thank you.
Thank you so much, sir, for your suggestion, for your commitment to storing the archives. Now I finally invite Dr. Sujit Sarkel, sir, Editor of the Indian Journal of Psychiatry, to kindly address the gathering.
Thank you, the members of the committee, and I welcome you all. I would
cut down the usual salutations and niceties just to save some time so that I can speak a few words. A selfish act, but I think I can have some additions. First of all, when we talk about history and archiving, I personally feel that when a person is in action in the present moment, when he is holding meetings, when he is writing documents, probably he doesn't know, or probably the people around him do not know that 10 years back, 20 years later, it will probably be a part of history. So when we are planning to archive or fish out old works, old documents, and plan to archive them simultaneously from now on, mostly in so much of activities related to IPS, when we are doing it in the present, we should also keep in mind a method wherein the next generation, when they try to fish out the data or the work that we have generated and documented, it becomes a little more organized. So to make it simple, I would say, for example, recently, for example, the ITOPS team, in the last few years, they have come up with quite important documents related to psychiatry education. Just one area I'm focusing. However, sometimes if people who are not regularly associated with IPS students, if they want to fish out a document which actually talks about a consensus on mental status examination, they may not get access to this, and they may get access to some less peer-reviewed material which is readily available to one of the so-called online teachers and all. So I personally feel that while we start documenting the past, the current things what we are doing should be archived or should be preserved in such a way that they are easily accessible. So maybe some of the websites can be there. It's basically like a digital library. So this is one. And my last suggestion is that when we hold so many national, international conferences and webinars, especially when we have a series of lectures, we rarely think of bringing out the conference proceedings. So I think that can be made a regular feature among all state, zonal, midterm, and whatever conferences, so that we do not miss out on the pearls of wisdom that are generated. These are the two submissions that I have, and over to the esteemed speakers. Thank you so much.
Thank you so much, sir, for your valuable suggestions. I think we will note them down to proceed ahead on those lines. Now I invite Dr. M. Kishore, sir, Chairperson of the IPS Faculty Development Subcommittee, who has been instrumental in conceptualizing and supporting such academic initiatives. I request him to address the gathering.
Good evening, everyone. It's a privilege to be part of this program. To the respected President of IPS, Dr. T.S.S. Rao, who supports all the initiative, to our Vice President, Dr. O.P. Singh, who has been associated for long and continues to support the psychiatry education, to the Secretary, Dr. Arun Marwale, to the Treasurer and the editor, Sujit Circle, who spoke so fluently on what we should do. This particular program we discussed with Professor Sanjeev Jain. We met in the Inspire program at NIMHANS. Pratima Murthy madam was the director who conceptualized the Inspire program, and Bhavish Saini, who is here, was also part of the Inspire program with us. And we thought where we should start the work when it comes to informing the undergraduate medical student, postgraduate psychiatry students, and the psychiatry teachers about what exactly we want them to remember. There cannot be a better person than Professor Sanjeev Jain. So, and now in our committee of faculty development, IPS subcommittee on this particular thing, which also has Professor Pratima Murthy as the guide, advisor to this committee, we discussed how well we can do this job. And we thought of starting a program, especially the online one, so that it is available in the records of this. Further, we can choose how we can make this possible, both physically and digitally. These are some of the things that everybody should discuss I'm really happy that IPS and ITOPS are working towards enhancement of these resources to everyone. And we look forward for this session. I'm really thankful to Dr. Priyansh Jain and Bhavish Saini, who took up this challenging task to moderate this and discuss this. Thank you so much. Over to you, Dr. Jain. Thank you.
Thank you so much, sir, for your guidance and for emphasizing the importance of this particular initiative. It is now my privilege to introduce our first speaker for the evening. Dr. Sanjeev Jain, sir, is an emeritus professor in Department of Psychiatry at NIMHANS, Bangalore. Sir's work has significantly shaped the field of biological psychiatry in India. He trained at Maulana Azad Medical College, Delhi University, and then he completed his post-graduation at NIMHANS. He has also been a Commonwealth Fellow at Cambridge, UK, and has co-directed international training programs supported by the NIH for Gravity Initiative. Importantly, for today's session, he has a deep and enduring interest in the history of psychiatry in India. He will be talking about what are the various historical documents of psychiatry and psychiatry education in India and their importance. Sir, we are honored to have you with us. I request you to kindly enlighten us on the topic.
Thank you, friends and colleagues. OP Singh, TSS Rao, Pratima, all the people who organize this, especially the ITOP team. And it's a pleasure to be here. If you can again guide me to the, where does one go? PowerPoint. Is it visible?
Yes, sir.
Yeah.
So you might have to set it on slideshow. Yes, sir. Yes.
Yeah. Yeah. So this is a very interesting topic because what I'll try to do in about 20 minutes is give the early history of psychiatric education in India. Now I'll be focusing mainly on the advent of contemporary psychiatry, and as we know, the Europeans so-called discovered the route to India sometime in the 15th century, and the East India Company established itself by helping the Mughal Empire get rid of some illness in the family. And this is a tombstone from Calcutta of William Hamilton, based on which he got the firman to set up a base in Calcutta. And then, of course, the East India Company gradually took over the rest of India. But before that, the Portuguese were here. And this particular book called Drugs from India by Garcia de Horta, written way back in 1691, is a compendium of drugs used in India. And that it includes many drugs used for psychiatric illness, for example, cannabis, ethanol, etc., etc. It was translated into English by Markham, who Markham Road in Bangalore commemorates him. So there's a lot of interest in Indian drugs. Now, these were very common in the 17th century because the Indian pharmacopoeia actually had specific drugs for depression. For example, this book from 1687 talks of Indian medicines to purge melancholy. So the idea that Indians have the medicines to treat depressive episodes was quite commonly held. It's a very complicated pharmacology, so I won't go into all that. But there's something called pill Indiae or myrobalance of India, which are supposed to be very effective antidepressants. So even by the middle of the last millennium, the idea that Indians had drugs for psychiatry was well established in Europe. And of course, when the British started having more formal interaction with Indian doctors, they were quite astonished by the amount of medical skill, especially surgical skill. As you can see by the professor of military surgery in 1808, no part of Indian medicine astonished me as much as the recoveries from the most severe extensive wounds, because they treat the sutures with neem leaves. And that gives rise to antisepsis and prevents infection. They also observe cataract operations being done, but they are very impressed by it, but they don't know how this works. So it's a very elaborate kind of, at that point of time, Indian doctors or Indian medicine is held in a higher esteem by the British than their own doctors. They prefer to employ Indian doctors for their armies rather than British doctors because they know medicine better and they know the native medicines and the processes by which people get better. Now, once they start actually establishing the East India Company and running hospitals, which is around 1800 when the first mental hospitals start, the Indian Medical Service gets established. The Indian Medical Service insists that every doctor who is employed by the company should have worked for 3 months in the practical instruction given to one of the public asylums for the treatment of the insane. So 3 month training is absolutely essential to get a job in India, because by then they are starting to build psychiatry and they need at least some people with have some idea of asylums. If case they have passed the exam, it is a very competitive exam and highly valued, and the best graduates of both Cambridge, Oxford, and Edinburgh get into this. If by chance they pass the exam, then within the time of passing the exam and leaving for India, they should produce a certificate for having worked in a mental hospital. So this idea that academic psychiatry needs training in a particular psychiatric service to manage psychiatric service in India is there by 1850. By that time, they also have to pass, like we have the IELTS, an exam in Hindustani for within 6 months of passing the exam, in another Indian language after another 6 months. So they need to know Hindustani plus one other common Indian language. And within a year, within 18 months, they should know either Arabic or Sanskrit or Persian, so that they can read the traditional medical textbooks of India and educate the British about the appropriate medicine in these three old traditions: Arabic medicine, Sanskritic medicine, and Persian medicine. So this idea of how ideas from India get incorporated into Western medicine are gradually put into place by 1850s, and all doctors coming to India have to have a training in psychiatry. So in the early 19th century itself, you have three textbooks written. You have several textbooks written. John Macpherson called Insanity in Europeans, 1853, which also talks about periodic insanity. This is the same time as Fowler is diagnosing circular insanity, so it's quite rapid. Ireland spends a long time in India and writes on basically mental handicap. And Wise, whom we'll be talking about, and Shaughnessy, whom we'll be talking about in a little while. So William Shaughnessy is very interesting because he's a graduate of the Trinity Medical College, Dublin. He's a gold medalist there, where he invents the use of saline for diarrhea. And because diarrhea is such a common problem in Bengal, he gets immediately posted as a professor of pharmacology, as the first professor of chemistry at the newly established Calcutta Medical College, which is the first medical college. He's also in charge of the telegraph and retires as sergeant major. So in 1839, he publishes the first book, his first monograph on the preparations of Indian hemp, where he discusses the use of cannabis as a treatment for catatonia and immobility. For this, he calls in experts in Unani from Calcutta and Tehran, which we all know is in Iran, an Ayurvedic physician, Pandit Madhusudan Gupta, and Mr. Da Costa, who's the pharmacist with the East Indian Company. So he looks at all these disciplines and finds various ways to make cannabis, tries it on patients with catatonia, immobility, after first trying it on medical students as volunteers. And he also treats tetanus, and he also notes that its abuse is quite common, especially in the Kala Firangis. Around the same time, around 1852, T.A. Weiss, who's otherwise a Sanskritist and a physician, he translates a lot of Indian textbooks on native herbs and the principles of medicine from Sanskrit into English. But he is also in charge of the Dhaka Asylum, where he notes that the rates of insanity in India are much lower than in England. And therefore, one of the aims of psychiatry was to determine whether the dark races of man are susceptible to mental and moral influences necessary to production of various forms of insanity, and the same plan of treatment as in Europe. So this idea of transcultural psychiatry, does psychiatric illness the same in India as in England, becomes very clear. But he is very critical about the state of so-called civilization. The Hindus are perhaps in a lower state of mental development, and therefore they are less prone to mental illness because they are not civilized enough. The book comes in for very severe criticism by Forbes Winslow, who is the editor of the Psychological Medicine Journal, who says that this is completely erroneous statement because I think it is guided by a racist attitude. We want to make profit and rule the country, therefore you're saying all this, and please don't be stupid. So T.A. Weiss basically disappears from the history of psychiatry after writing this book, which is quite interesting. It is interesting for the amount of psychopathological detail. He describes about 100 cases in considerable detail, and those are very, very fascinating, the case histories from Bengal in 1852. By the 1850s, 60s, when the Calcutta Medical College and then medical colleges get established all over India, you find lots of Indian doctors writing in journals published from India, Indian Medical Gazette, or in the BMJ. So, for example, you have Pandurang, who's talking about hysteria. You have Delaney, you have Ramchandra Mittar talking about treatment of mania, You have bromide in potassium of insanity. You have Chetan Shah who talking about how native doctors or native hakims actually have a lot of knowledge about local custom. So Pandurang, Ramchandar Mehta, Chetan Shah, K.C. Bose, who writes on cocaine and its intoxicating effects by 1899. The paper is published in 1900. So this idea of Indian doctors getting familiar with psychiatry is present by the 19th century. Many other Indian doctors are mentioned in the annual reports because by this they are actually running the hospitals on a day-to-day basis. The superintendents can be British Army officers, but the actual work is done by the Indian doctors who are graduates from the various medical colleges. So whether it's in Lahore or Peshawar or Tezpur or Bangalore, the actual ground doctors are all Indian and they write all these kinds of reports very easily. However, despite all this, the Royal College in England has a very poor opinion of psychiatry in India. They say there are only 4,300 patients in the asylums of British India with a population of 23 million, 2.3 crores at that point of time. We are now 140 crores and 4,000 patients. Other than the Kingdom of Mysore, no other native state had an asylum. And the most troublesome was that the hospitals were being managed by people with no training in psychiatry. So the fact that we were being managed by people with no training really angers the president of the Royal College. And of course, there was 80% are unable to access treatment. So this lack of training is then to be covered by posting people from England who are specifically interested in psychiatry. So G.F.W. Evans has trained at King's College in London, where he is basically a neuroscientist. As you can see in the paper below, he writes on the theory of cortical visual representation. So he's a kind of an organic psychiatrist. He gets sent to India in around 1900, by which time he has already read the first textbook, the first version of the textbook of Kraepelin of 1896, and therefore he writes a paper on the evidence of dementia precox in the Punjab asylum at Lahore. And he says that both natives of India and Europeans have dementia precox. And as you can see in the description, it is actually an excellent description of what early onset schizophrenia is. The book describes in detail the administrative and legal issues that come up in handling issues related to insanity. And this book, called Insanity in India, published way back in 1902, is one of the first formal textbooks. Please remember, these are not postgraduate textbooks, these are undergraduate textbooks, mainly for the students in India, to make them aware of the rules for admission to mental hospitals and describe briefly the signs and symptoms of each disorder. So whether dementia precox, delusion, insanity, etc., these are all covered in Insanity in India. He dies very suddenly in just before the Second World War, and many newspapers in India carry obituaries about him because very deeply loved in the Punjab. He is followed by a person called Overbeck Wright, who is a long so-called company family, his father and his grandfather and his father. So 4 generations of doctors have worked in India, including 4 generations of officers have worked in India. And Overbeck Wright has trained in Scotland. Now, this is a very important distinction because he's trained in Scotland. He has no time for psychoanalysis and hypnosis, which is just coming up. And he writes a book called Mental Derangement in India, which he describes as being basically meant for the training of students and training of and helping in early diagnosis and treatment and typical case of hysteria, etc., etc. A book reviewer finds that the book is very old-fashioned. It doesn't include mention of Freud and Jung and all these others who are just coming up in the early 20th century. And psychosocial causes are totally neglected. Overbeck writes, as you can see, that this obsession with psychoanalysis is quite wrong, and this is not a cure for all mental disorders. It is very limited, and these disorders may not even be called insanity, and my book is about insanity. So this debate between the wider spectrum of psychological issues and so-called insanity starts making up. In addition, he also writes a very elaborate, he rewrites the book called Lunacy in India by 1921, in which he is actually quite aware of psychopathological detail. The book is filled with lots and lots of case material, again mainly from northern India, where he has worked most of the time in Agra and Lahore. but it has very, very interesting case notes. It's got very interesting legal notes. And the BMJ says it is rich in detail and anecdotes and nuanced description of psychopathology and presumed etiologies and the situation that confront the superintendent. It fulfills AB, the object for which it is compiled to be a guide and aid in the disposal and treatment of lunatics in India. It's a book meant for students, and many writers write books like these. Of course, he's also writing on syphilis and things like that. The fact that by this time, the students in India, and this is not true just of the medical colleges, but also the medical schools, the British have introduced a 3-year medical school system which produces LMPs. And these are being reviewed in 1918 during the First World War. And this is the first question in the final year medicine exam. Describe the signs and symptoms of acute mania. How would you treat a case? Now, we have been struggling for years now to have a full question in medicine exam for psychiatry, and to find that it is there in 1918 for an LMP exam, and not necessarily just for the MBBS. The MBBS ones have even more elaborate questions. So psychiatry becomes incorporated into the teaching of psychiatry of medicine in the medical colleges of British India by around this time. Into this comes Berkeley Hill, who's a very colorful psychiatrist trained at Oxford. He gets married soon after he comes to India to Karimbil Konimani, who's from Kannur in Kerala. And he's familiar with Hindustani, Telugu, Arabic, Bengali, Malayalam, Swahili, Latin, and French, in addition to English. So he's a well-read man, he's very, very competent to understand Indian culture, both from southern India, central India, Western India. He serves for a time in Lahore and Ranchi and in Bombay. He makes a very early and forceful demand for increased attention to psychiatry, especially for undergraduate medical education. And he points out that the government did not realize that one mental disorder, dementia precox, cost the country more in maintaining its helpless victims than any other single disease. And therefore, this has to be included. So these are some of his papers on psychoanalysis by habit formation, and most importantly, the supposition of psychology in the teaching of medicine in the Indian Medical Gazette, which lays out the plan as to how psychology can be incorporated into general MBBS training, and therefore it's important for future psychiatrists. Of course, he does lots of work with Kraepelin and things like that, and he petitions the government for starting course in medical psychology at a few universities, mainly in Patna, Lucknow, Bangalore, Calcutta, having regular case conferences with Mufassil doctors so that this can happen and improve the working of the dispensaries, much like community psychiatry does now, and orientation visits from the Mufassils to the big institutes, let's say at Ranchi or Madras or Agra, and regular meetings, much like what we have with the IPS. He is a close associate of Girindra Shekhar Bose and the Psychoanalytical Society, and takes over as president after Bose. He has a very sharp mind, but is thought to be scandalous by Mavata because he is married an Indian woman, and has very, very good friends with the Indians, and most of his friends are actually Indian. You can see some of his books, Psychology of the Sari, The Psychology of the Germans, The Psychology of the Anus, The Early Signs of Mental Disorder, and Wasserman's Study, and even writes on communalism and comparison between the mental process in the sane and insane. These documents have been gifted by Berkeley Hill's family, and they're part of at the moment a private collection. Of course, there is he also starts the very first so-called postgraduate training. He gets permission from the University of London to do a diploma in psychological medicine in 1922. This is well before all our records. So one Jyotirmoy Roy, who then goes on to work on the mental hospital in Nagpur, and after that he migrates to England, where we lose him, but where we don't have any further track. But he's probably the first person in India to get a specific diploma from India while working in India from England. Now, he also does a whole lot of other training, which we can talk about in detail, but basically he's talking about how to improve education. Berkeley Hill is assisted for some time by Norman Pacheco, who's actually assistant to Dr. Dunji Boy. Dr. Dunji Boy is the head of the Indian Mental Hospital in Ranchi, and Norman Pacheco is an Anglo-Indian born probably in Bangalore, because at least he retires to Bangalore, who has served in both world wars as a medical assistant in the First World War and as an officer in the Second World War. So he spends all his life in military psychiatry, and he writes these books on mental hygiene in India and, of course, modern methods in psychiatry. The chapter on modern methods in psychiatry is very, very organic because he talks about Emil Kraepelin as a loss of inner unity of the activities of intellect, emotion, and volition, and is simply dementia antedated in youth, and it is signs of early onset. Important factors are hereditary, and children, and if they escape dementia, the next pitfall is dementia precox. So neurodevelopmental hypothesis for schizophrenia. So Julian Norman Pacheco is therefore a fairly well-informed psychiatrist. He probably is not a full doctor. He has graduated from the LMP and gets trained in England in psychiatry, but he ends up heading the Ranchi Hospital for Indians for a short while till the Second World War, in which point he is called back to the army and he retires soon after. So Norman Pacheco is a very important but forgotten person in this modern methods of psychiatry, which remains the first textbook of psychiatry written in India by an Indian. So it keeps the psychosis as a major focus, its cause of susceptibility to disease and its progression from childhood to old age as a continuum. It advises on mental hygiene, which includes advice on school mental health program, outpatient clinics, methods for care for the incurables, much like what we talk about even now. It also provides a summary of general psychology, which blends Freud with Babinski and neurobiology with psychic determinism. He's also concerned about increasing rates of suicide and advocated a suicide prevention policy as part of the formal textbook of psychiatry. So you can see that even in the 1930s, many of the things that are concerning us even now in the 2020s have already become evident to the early psychiatrists of India. He retires in Bangalore and lives in Richmond town, where his family runs a very old auctioneering service. His children have now migrated to Australia, and we are trying to get his records, but it's a very interesting profile between Ranchi and Bangalore. In the 1920s, after the First World War, when many Indian doctors serve in the war and become officers, and there is a move in England to start specialist training in London because Kraepelin has started a specialist training in Munich. Both the institutes in London and Munich are paid for by the Rockefeller Foundation. The Americans pay funds for the travel and for the arrangements, as does the government of India. That's colonial India. And doctors from all over India are sent to England to train, acquire formal degrees in psychiatry, and the early list includes Frank Narona, Barasi Das, Venkat Subbarao, Purushottam, C.C. Saha, Johnson, Govind Swami. It would be very, very interesting for us to be able to develop archives tracing each of these doctors from each of these hospitals, because getting these archives, what they did, what they learned, and how they changed the hospitals would be a very important aspect of the work of psychiatry. Dr. Narona is introduced to psychiatry to the Royal College by Sir Frederick Mott and Professor Gola. Both of them, one is a geneticist and one is a neuropathologist, who are very active in psychosurgery. And this produces a kind of organic bent at the hospital in Mysore. As you can see, the first paper published by him is observation on case of dementia precox as seen in the asylum Bangalore, now called NIMHANS, but basically the lunatic asylum of Bangalore. At the same time, soon after 1930s, by the time all these doctors are coming back, Sen and Bose, the same Bose who wrote on the cocaine epidemic of India, now discovers that raw wolfia serpentina is a very useful treatment for mental disorders, and that is researched by various doctors like Kahali and others. But these powders are very effective in the treatment of mania. Dunjiboy and Govind Swami, on the other hand, are very unimpressed. Pacheco in his notes finds that Resupine is very, very useful. But this basically goes out of favor by the 1940s, and it is almost forgotten until the Americans discover it. But that's a separate story. This is also helped by a person called Salamin Zaman Siddiqui, who is a PhD from Berlin. But before that, he has studied in Calcutta. He is from Shantiniketan, and he's a very good painter of the Bengal school and then the German expressionist school. So he writes in Bengali and Urdu. He studied in Shantiniketan, translates from all over, and is able to extract every known alkaloid or wolfia except Resupine. Unfortunately, the technology to extract reserpine develops only after the Second World War, so he misses the Nobel Prize because the person who extracts reserpine gets a Nobel Prize, and all the biological psychiatry that we know, pharmacology that we know, follows from the action of reserpine. He is very preoccupied by the fundamental unity of human beings, and he quotes Sheikh Sadi, and which is now the slogan for the UNESCO. But he is forced to migrate to Pakistan after independence, although his wife continues to live in Delhi. So, in a way, he's linked to the early development of psychiatry in India. In the 1930s, Edward Mapother is invited to come to India by fellow graduates by graduate students from Maudsley. Like I mentioned, all the students from South Asia are sent to Maudsley to train. And Mapother is invited back by the students in Sri Lanka, where one of the students has happened to become a member of their governing council of the parliament. So he compares that India lags far behind UK, that ratio of psychiatric beds 5 to 8 in London, 1:7 in India, and the cost of asylum is only 9% of the total health expense. It is now less than 2%, where it is 25% in the UK. The London asylums alone cost 2.2 million British pounds. The whole of India cost only £250,000. And of course, food differences are enormous, much like the NHRC report that Pratima worked on. But what is most important is that he's told by Lord North, one of the members of parliament in London, the House of Lords, that Mysore Kingdom is far ahead of the British India, and the Bangalore asylum is one of the best in India. This is also very important because as a political system, it is a native state, and India is going to get independent in the near future. 1931, the Independent India Act has already been passed, and this is 1938. So India is waiting to become independent, and after independence, the fact of a mental hospital in a native state will carry greater relevance than one which has been managed by the British. It is very scientific. It is open to Western science and technology, as evinced by the fact of the Indian Institute of Science and and all these other big institutes that the Maharaja of Mysore has paid for, the Mysore Medical College, ISC, the Victoria Hospital, and it is very, very cosmopolitan and very non-communal. Non-communal because Mahatma Gandhi is there visiting Sir Mirza Ismail and his wife. He's technically a prisoner of Mysore state because he's preaching sedition, but instead of putting him in a prison, he's a personal guest of Mirza Ismail, and nobody bothers. And Mirza Ismail, of course, is a close friend of the Maharaja, and you can see both of them at Croydon Airport in London. So this kind of combination of political, scientific, and social stability suggests that this institute, that the asylum in Bangalore should be made a postgraduate college. And therefore, there's an urgent need to develop a school in India because soon after 1940s, we cannot afford to have so many Indians in the UK. Mapother actually comments on the fact that many British doctors don't like too many Indian doctors around. So he's aware of the subtle racism. He himself is Irish, and he's also aware of the subtle racism that exists within the Maudsley and the Bethlehem schools. So we can't really get so many Indian doctors, and therefore a postgraduate school east of the Suez, for the British Empire, is therefore very good. And he makes a specific suggestion that psychiatric wards to be provided in all general hospitals, chronic cases sent to asylums, and Govind Swami is repeating whatever he's learned at the Maudsley, and therefore he can be trusted at this point in time. 1939, the Royal Medical Psychological Association gets started. And one of the more important things is that India has more psychiatrists than Canada and Australia combined. And therefore, it is appropriate and takes the lead for psychiatric education. It is nudged along by Banarsi Das, Lodge Patch, and all the others that we talked about. There are three psychiatrists here who are very important, four actually. Satyanand in this photograph, who is the founder professor of the Department of Psychiatry at AIIMS. Dr. Shah, who wants to introduce medical psychology into the curriculum. At that point, he's the superintendent of Irvine Hospital. And at the point of partition, he goes to Karachi and becomes, and Rizvi, who also MS Shah goes to Lahore, and Rizvi goes to Karachi and changes his discipline to a cardiologist. But at that point, he writes a whole essay, gives a whole speech on starting neuropsychiatric clinics so that organic brain disease can be looked at. As you can see, 1939 psychiatry is very much orienting towards the medical and organic space. The photograph itself is a gift from Professor Sunil Pandya and Dr. Dungaji's family, but I think the IJP has the original, better preserved copy in its icons. So after independence, when the school gets started, Professor William A. Gross gets posted through the WHO to start thinking about psychiatry in India. He himself has trained with NISL and appointed as a professor extraordinary in 1929, one of the youngest full professors in Germany. Germany professorship is extremely valued and extremely rare. And he is editor of Nervensart. And he has to emigrate to England under the Rockefeller program because he's Jewish. He becomes friends with Govind Swami because Govind Swami is sent to Morsty at the same time, and he starts setting up the center at Bangalore. It is during his time in Bangalore that he writes his textbook of psychiatry. We had some of the early notes and lecture notes which were used for his textbook in Bangalore, and the two become good friends. And the training program at NIMHANS is basically a copy of what he has developed, what is being developed at the Maudsley and Bethlehem. This is a note that Mayor Gross writes on memorandum of undergraduate teaching of psychiatry. These are handmade. These are typescript notes again in archives in the UK. So for every undergraduate, you should have 6 introductory lectures on general psychology, 14 lectures and 28 hours of clinical exposure to psychiatric cases, 3 months of OPD clinics, and 5 visits to a mental hospital. This is for undergraduate students. This should be the minimum training for undergraduate students for psychiatry as per the Good Enough report of the UK. And Mayor Gross is very enthusiastic that this kind of training be offered in India too. These kinds of ideas form the basis of Satyanand because he shifts the focus quite a lot to social psychotherapy, to social psychiatry. He wants to use psychodrama, he wants to use dream interpretation, he wants to correct the prevailing bad community ego development. This is soon after the partition. He has seen what has happened in Lahore and Delhi. So he's very worried about the social, the fraying of the social fabric. And his interest is more towards correcting the social pathology of India at that point of time, because it is a very immature and defective community ego at that point of time. And he wants to interrogate the entire relationship of God and man, religion and totalitarianism, and how all religions can be a continuum of the unconscious of the whole human race. So he has a very different notion of social psychiatry. At the same time, he is also very biologically minded because he also talks about fatal bone marrow aplasia following phenothiazines. He talks about leucotomies, and he talks about the biochemistry of behavior. So in his own complicated way, he tries to combine psychoanalysis with psychosurgery. One of the few attempts in the middle of the 20th century for a one given person to combine both hats. And then, of course, is NIMHANS gets set up. And then Pratima will tell you more. Pratima and Dr. Mohan can tell you about more recent postgraduate education. But as you can see, the practice of psychiatry in India is a mixture of UK, Europe, and India. And it moves gradually from asylum-based psychiatry to community medicine and public health psychiatry over 150 years. Although initially introduced by East India Company, it becomes a part of the imperial system as the governments change. And psychiatry was a part of the academic training for all students, but in the absence of great public or civic engagement and the colonial rule, the progress was very slow. The individual doctors, like I point out, from Evans to Overbeck Wright to Lodge Patch to Berkeley Hill to Satyanand to Govind Swami and Parshuram and Banarsi Das, all have made their own significant improvements. And this is a process that still goes on. Thank you very much for your attention. And over to you, Pratima.
Thank you. Just wanted to check with Dr. Priyansh and Dr. Saini that I can start.
Yes, ma'am. Just a few words of your introduction, if I may.
Oh, sure, please.
So it is my privilege to introduce Dr. Pratima Murthy, ma'am, the former director and now senior professor of psychiatry at NIMHANS. She is a leading authority in addiction psychiatry and with over 3 decades of experience in clinical cases, research, as well as policy making. She has recently led and inaugurated the NIMHANS Archiving Digital Initiative, which is one of the world's largest mental health archives with records dating back to the 1890s. Given this remarkable work, her insights on how we archive and preserve our heritage is especially relevant today. So without further wasting any time, I invite ma'am to please deliver her talk. Thank you.
Thank you very much. My warm regards to all the office bearers of the Indian Psychiatric Society and of the ITOPS, and thank you for having me. It's really wonderful to be talking on a subject which is very, very close to my heart. I must also tell you in a matter of passing that Bangalore's temperature right now has come down from 37 to 20 degrees, but then we have no power. So I'm trying to work this presentation on on my mobile phone connected to my computer. I've gone through 3 computers and I hope this one works while I complete my presentation. So what I'm going to do in continuation of what Sanjeev said is really talk about, in some ways, a personal narrative journey of how exciting it has been to actually be involved in documenting the history as well as archiving records. And I hope this is going to be an inspiration to all the members of the Indian Psychiatric Society, the teachers, as well as the students, to get involved in really understanding the method in madness, which I've chosen to call this particular, topic. Paulus Buck very wisely said, if you want to understand today, you have to search yesterday. And it's amazing how things kind of come back periodically. I mean, the best example was possibly COVID, when a lot of psychiatric drugs which were used earlier were repurposed, to fight the infection against COVID. More than that, I think understanding people, persons, events, discoveries, things that happened in the past will definitely inform us and prepare us better for the future. So what I'm going to do is really talk to you on about 10 areas. First of all, my senior residency and how I stumbled upon history, talking about various other, steps in my own journey in being involved in archiving, and finally try to see from the past how we go into the future. So let me start off with my senior residency days. You see some records on the left side, but these were not in this manner. They were just strewed. And I remember as a senior resident, when I went to the medical records department, that I accidentally stumbled upon some of these registers, which actually were registers of the late 1800s. What struck me most was the fantastic calligraphy. It was practically like calligraphy, the handwriting of possibly the clerical staff who maintained the registers, and the very, very meticulous recording of these registers in terms of the details of patients, their backgrounds, the diagnosis, what happened to them, etc. And these were possibly kind of strewn here and there because the medical record section at NIMHANS was being repaired. But soon enough, this was fascinating. And what it led to was, of course, my interest in forensic psychiatry. And the first possible set of registers was to do with admissions to the forensic psychiatry ward. And therefore, what I did was undertook an analysis of criminal admissions in the early 1900s to the mental hospital, Mysore Government Mental Hospital. And that led to my first presentation at the World Psychiatry Association 1996 Congress in Madrid, Spain. And it was fascinating to really go through all of those details of the admissions. And I remember there was a newspaper write-up on it as well, that the commonest diagnosis with schizophrenia and the commonest criminal charge was obviously IPC 302. And these the documents were so much in detail that it really helped to understand quite a bit about what was happening. Soon enough, I became a faculty at NIMHANS, and of course, my comrade in arms, Dr. Sanjeev, who's given you a fascinating kind of account of the early development of psychiatry and its influence on Indian psychiatry. We developed this fascination, started looking at the records, and realized that there was so much that needed to be done. And the first thing that needed to be done was the preservation of the records, because there have been times when old records have been burnt in institutions. And I'm sure to this very day, this happens. There is very little understanding of the need to preserve, to collate, to keep, and to archive data. Although I believe in the last decade, it has changed. And I do hope that some of our own efforts have stimulated others to kind of do the archiving. And then, of course, we started small. what we did was started securing these registers, the files, the various documents. Sanjeev went to the UK several times, to the Wellcome Library and collected a lot of material from there. It's amazing that there's so much more data in the UK than there is perhaps in the libraries in India itself. And of course, I must acknowledge at this point Mr. Joseph, who was the medical records officer. Joseph actually got very excited that we were scurrying around getting all these records together. And every time he'd find a record, he'd call one of us and tell us that he found this. And then, of course, there was this fascinating gentleman called Mr. Pradeep. I'm sure Dr. Mohan, Matthew, Sanjeev, it kind of bring back memories of Pradeep and his extraordinary memory of patients and files. And Pradeep again would be able to tell us, he would ask us about the progress, with the archives and so on. What we managed to do at that time is just get a couple of cupboards in one of the corridors of the medical records section. And we just kept all of these documents there so that they wouldn't get damaged or further destroyed. Amazing that actually somebody had taken the responsibility of binding many of the registers. So actually they were quite in good shape, except they were very dusty. And of course, we needed to kind of chronologically arrange these registers. And you'll see there is this pile of registers from 1910, 1918 on top to a whole lot of, to the successive decades going forward. And you'll also see the civil and military, station registers. So you kind of find the admissions to the Mysore Government Mental Hospital, as well as cases seen in the civil and military stations, which has an absolutely amazing treasure of information about patients, their diagnosis, and what they were admitted with. Then, of course, that led us to go to the state archives.
Excuse
and
me, ma'am.
again, in the archives, we found a lot of material.
Excuse me, ma'am.
Ma'am,
Ma'am,
Yeah?
sorry to be interrupting. Ma'am, are
Yeah?
you sharing the slides? Because we are not able to
You can't see the
the
slides.
No.
Oh, I'm so sorry. How's that possible? Oh, goodness. 1 second, just give me a... Can you see it now?
No.
no, ma'am.
I wish you told me earlier.
I was trying to.
Okay, just give me a second. Yeah,
Yeah, now it's
just give me
coming
a
up.
second. Oh. Today has been a difficult day with all kinds of technology. Just give me a second, please. Able to see it now?
No.
No, ma'am.
Ma'am, you might have to share the window, the presentation window.
Yeah, it's
Just
coming
a
up now.
minute. Yeah.
Still blank.
Yeah, is that...
Yeah,
Can you see it now?
Yeah.
Yes,
I'm so sorry. I'm so sorry about that. I got carried away, I guess. So I'll just quickly take you through these initial slides. Pearl's Buck, the personal narrative. These are the, the registers which were lying around everywhere. And this was the presentation at the World Psychiatry Association about the criminal admissions at NIMHANS. My comrade in arms, you already heard him. And of course, the initial archiving that we did and the help that Mr. Joseph and Mr. Pradeep provided to us, a neat stacking of all the records from 1910, 1911 onwards. And yeah, I was here. So this is the State Archives, which is at the basement of the beautiful Vidhana Saudha. And actually, the State Archives had some amazing material in terms of the correspondence between Govind Swami and the Secretariat, particularly in terms of the diet for the patients, medications that were available. So what I want to say is that, and we subsequently visited archives in Tamil Nadu also, and it's fascinating that that many of the state archives have some amazingly fantastic material related to the early development of psychiatric institutions, and therefore people must be encouraged to go to these archives. And of course, there are other public sources which are available. I remember going to the census office, and we actually got information about the census and the mentally ill who were counted as part of the census in Kendriya Sadan. Then, of course, there were family members. Sanjeev had a personal contact with the family of Dr. Norona, provided a lot of material. Similarly, Dr. Govind Swami's family also provided materials. So you've got to be able to go out and contact people and get the material so that you can all put it all together. So it's very important not only to rely on records from the hospitals, but also look at collateral information. The first trainee that we got interested is Dr. Satish Chandra, who you see in this photograph. This morning, I just reached out to his wife. Unfortunately, Satish passed away during COVID. He was a senior, doctor in the CGHS, and I think he was slated to become the DD, the local Director General of Health Services in the CGHS, but he unfortunately passed away. And Satish did one of the first evaluations of some of the patient admissions in the early 20th century, before the discovery of psychotropic medication. And we found that even at that time, in the pre-chlorpromazine era, outcome was good, and a majority of the patients actually recovered and were sent home to their families. There were several other details in terms of the diagnoses at those times, what the patient's background was, how they recovered, whether they were brought in as voluntary patients or involuntary. And one of the very striking factors in the Mysore Government Mental Hospital was that a lot of the patients right from the beginning were indeed brought voluntarily, although of course a majority were involuntary patients. So, as I said, we started small. We started writing articles in the Indian Psychiatric Society Karnataka bulletin section on history. Again, a very important point, that it's important to stimulate interest in history. And Sanjeev, Vivek, I remember MV Ashok again. Again, Ashok is not in our midst. I do remember that Ashok also had an interest in some aspects of, of psychiatric disorders, in the history of psychiatric disorders. So what writing did we do? We wrote about people, particularly the early stalwarts that Sanjeev talked about. We were particularly interested in people who started services in Bangalore. That is Dr. Francis Norona, Dr. Govind Swami, Dr. Murthy Rao, and several other people. The institutions where, where these services had started. So these were primarily, apart from the NIMHANS that we were interested in, the IMA Chennai, Ranchi, Tezpur, institutions like that, which have a very long history. And of course, procedures in terms of investigations, in terms of treatments, in terms of recovery of patients and responses to these procedures. So, for example, when we looked at convulsive therapies, you found that ammonium chloride was used as a convulsant earlier on, and then cardiazol was used, and then subsequently, of course, insulin coma was used, and then direct ECTs, and then modified ECTs. So you can actually study responses to various people. Govind Swami had written several articles on, for example, the high temperatures and therefore the problems with insulin coma. So several things can be really understood in terms of the cultural and the socio-cultural milieus and the effect they may have in terms of the response to treatment. Another very important fact was, very soon on the heels of something being discovered in Europe or indeed America, within a couple of years, those investigations or those treatments also got introduced into the Mysore Government Mental Hospital. So despite there being no fast kind of communication between continents, discoveries and treatments pretty quickly came to be used in India as well. Now, this also meant that more trainees also got interested. Although I must admit, in the beginning, it was quite a challenge to get people to get hooked on to looking at archival data. It is quite tedious. There's a lot of dust in the archives, and it requires a lot of application. But I believe over time we've got more and more people interested in these archives. Then, of course, we started putting some of that information in various kinds of souvenirs. This is the Golden Jubilee volume that was released in 2004, and that had a section on history. So every time there was an opportunity to write on history, we used to do that. So that now there are many compilations which talk about the history of our institution. And then at the institution level, we were able to put together a Golden Jubilee commemorative volume, which looked at integrating mental health and the neurosciences. Then there have been colleagues who've written about the history of neurosciences. Sanjeev mentioned Dr. Sunil Pandya, and subsequently some of our own colleagues. I remember Dwarkanath wrote an article on the history of neurosciences. The Neurologists Association have also written, monographs on the contributions of various neurologists. So the whole idea is to try and see how these sciences grew and whether, of course, they subsequently grew more in parallel than in an integrated fashion. But I think those are integrating mental health and the neurosciences going forward. Then, of course, came the war. And then you'll see that the welcome grant, where you see Alok. Alok, I had that earlier photograph that you've put on your DP, but this is a better photograph, so I've used this. And we all came together. And there was Nadia, and there was, I think Vikram was also one of the advisors on this particular grant. You see the two young people here are our first PhD students in the history of psychiatry. And there's Radhika, who was a postdoc. And the welcome grant gave us the opportunity to put a whole lot of things together in perspective and have people work full time. As busy clinicians, we simply couldn't give the time and the effort that was required. And certainly having people on board also increased the enthusiasm to work and helped us to bring things to better fruition. So the output from the welcome grant was that there was archival compilation and digitization, not only the digitization of records at NIMHANS, but going to Dharwad. And actually, of course, we did not digitize those records, but it also meant prior to this, we had gone to the archives in Karnataka and we had made microfilms. Now, microfilms are very, very difficult to actually read off. And therefore, now with better technology, we were able to then have a company come in and start to digitize the records as well. And then, of course, various kinds of publications also came as part of the welcome grant activities, from the board committee and the members of the board committee to the birth of various kinds of institutions. There have been publications across a range of different kinds of topics. Alok and Sanjeev, authored a book on, edited a book on the partition of India. Again, a lot was taken from the archives. Several seminars and symposia were held. We also held a lot of public outreach activities where we tried to engage the public in interest in historical, data. And there were PhD and postdoctoral programs that also came as an effect of this. So one PhD was Pradipto Roy, who looked at madness, psychiatry, and society, particularly in terms of the institutions of West Bengal. He also looked at lay literature in Bengali on mental health. That was Mitchell Weiss and Dury were involved in that, along with both of us. And then, of course, Sarah Ghani looked at the records of the Mysore government mental hospital in the early 20th century, looking at both the medical as well as the social history. Again, gave us very, very valuable insights into gender, into conditions like hysteria, depression, dissociation. A whole lot of things came out from Sarah Ghani's PhD thesis. Subsequently, we've had MD dissertations of students looking at substance use across, the different time points, phenomenologies of delusions and how they changed over time. And now my younger colleagues have also been guiding students in doing thesis based on the archival data. Also came out of this a reconstruction of the histories of mental hospitals, a monograph which looked at the history of mental hospitals all over the country, an exhibition. I'll just see if I can play this video for you. Okay. I think we'll just skip the video in terms of time, but this basically shows you the Okay. So I'll just go to the next slide just to give you a sample of what it was like. This was the Bangalore, the exhibit on the Bangalore Asylum, how it started, how, for example, the records of Charles Irving Smith, who worked in the cantonment in Bangalore, the first mental hospital building in the Pete area, which subsequently shifted to the Hosur Road, and of course, what happened in terms of the transition of power from the Mysore kingdom, at that time. And that also led to the publication of this illustrated history of Neman's mindscapes and landscapes. You'll see this beautiful building, which was built in the early 1930s, and then subsequently the first floor was added, and then subsequently the rest of Neman's also came up. And this was how beautifully the gardens were laid out, and you'll see how much dear the whole place has
Pratima, the
become.
slides aren't
These
moving.
gardens that are there stay to this very day. And, that's again that one needs to make sure that one keeps when you have legacy buildings, when you have gardens and environments. Oh, darn, this is terrible, isn't it? What do I
Ma'am,
do now?
ma'am, we are
Okay,
actually
let me try
having,
it again.
ma'am, we are having a connection lag over here. Maybe if you can turn off your video, then
Just give
we
me a
might
second. I'm
get
really,
audio and presentation.
yeah.
Now she's logged off.
I think ma'am got disconnected somehow.
Yeah.
We'll just establish connection with ma'am and continue.
Got it.
Ma'am, you are not audible.
Ma'am, you're muted.
Can you hear me now?
Yes.
Yes,
Yes,
ma'am.
ma'am.
Ma'am, if you can turn your video off, the audio will be more.
Oh, okay. I can do that, yeah.
Okay.
Okay, are you able to see my slides?
Yes, ma'am.
Can you see it now? Dr. Priyansh, can you see my slides?
Ma'am, we can see your slides. You might have to turn on the slideshow now.
Okay. So you'll see also there is of leucomy in the case file. Things Dr. Murthy.
Sorry for the inconveniences. Ma'am, you're not audible
Is
now.
it on slideshow now?
Yes, ma'am. Yes, ma'am. It is
Yes,
on
ma'am.
slideshow. Yes.
Can you hear me?
Yes, ma'am.
Okay. Okay. So here's the this thing about the insulin coma, the recording of the insulin coma, the amount of insulin that was required, the recovery of the patient from the insulin coma, and of course, subsequently, documentations of leucotomy and so on. Sanjeev already showed you this picture about M.V. Govindswamy, who trained in the Maudsley and with the help of Mayor Gross started some of the initial programs. And in fact, it was not just the programs for the training of psychiatrists, but also the training of nurses and subsequently WHO consultants who came to start EEG. And then Dr. Mani first worked there and then started the Department of Neurology, and subsequently the neurosurgery department was also started when Dr. R.M. Varma came to perform leucotomies with psychiatric disorders. Similarly, the IPS archives also have, this is the first edition of the archive, 1948. And since then, of course, there's fantastic information that is available in terms of the early developments of the psychiatry in India, as seen through the publications of the Indian Psychiatric Society. In ANSIPS 26, that was conducted in Bhopal, I remember Alok and I were involved in organizing that. And unfortunately, I couldn't locate it on the IPS, the IJP website. And I think it's very, very important that these kinds of young
Once again, sorry for the inconveniences. I think ma'am has got disconnected due to the technical glitches.
This is not me, this is the power situation that is causing this problem. I'm constantly getting cut off. Can you hear me now? Are you able to hear me now?
Yes, ma'am. Yeah, you're audible.
So I'm just going to try one last time.
Okay, ma'am.
Yeah, can you see the slides?
Yes, ma'am. They are yet
Yeah,
to
so this is the Nimans
slide show.
Heritage Museum building. And
Yes.
yeah, and you'll see that, is it not in slideshow? Dr. Saini?
It is
Is
now,
it okay?
ma'am. It is okay, ma'am.
Okay. Okay, you'll see that the Honorable President of India, when he was inaugurating NIMHANS as an institute of national importance, also inaugurated the NIMHANS Heritage Museum. So what I'm trying to say is that if you take the archives to a logical, take it forward logically, there can be a lot of good things that come out of it. And this was Her Highness, the Maharani of Mysore, along with now the present Maharaja of Mysore, who is an honorable member of parliament, actually inaugurating the Heritage Museum that we have at NIMHANS. And you'll see that it's also about people and how the mental hospital moved from its original location of the lunatic asylum to its current location at where NIMHANS stands today. And there's a lot of information in terms of the diets that patients got, in terms of the treatments that patients got. You can also, for example, these archives have also fed into other activities of the Indian Psychiatric Society Karnataka zone. The Suvarna Sambrama was the commemorative volume commemorating 50 years of the Indian Psychiatric Society Karnataka chapter. And once again, much of the information from the archives could be used to look at the history of development of psychiatric services in Karnataka. Similarly, when we were looking at 50 years of the Sakalvara, there can also be a lot of historical narratives which can also feed in to these kind of publications. So therefore, again, very important to look at. And several other kind of publications can come out of it. I also wanted to say that keeping narratives is very important. This is one example where very senior psychiatrist Dr. Venkatramaya put down his recollections and reminiscences about the Dharwad Institute of Mental Health and Neurosciences, and we were able to bring a small publication. But there's a lot of potential in Dharwad to look at the records, to look at all the kind of memorabilia that are there to make a very, very good archival section in Dharwad. And similarly in other places like Ranchi and Tezpur, again, I need to really get their archives together. In the last 5 minutes, I'll just talk about the NADI, which was mentioned earlier, the NIMHANS Archiving Digital Initiative, which was culminated in 2025. It started off with all the efforts I spoke about digitization earlier. And this helps to prevent, to preserve and have controlled access to a wide array of archived material which documents the care of brain and mental health at NIMHANS. And as we said earlier, we had stopped at 1954, which was the All India Institute of Mental Health. But then we were able to expand it from 1954 to when we became NIMHANS in 1974. The archives has digitized case files, registers, and several other resources, including images, videos, audios, and so on. And several people have been involved with the archiving, and the funds that were available from the Welcome project were used for this kind of archiving. So we have the lunatic asylum data up to 1924, the Mysore Mental Hospital data till 1945, and the All India Institute data from 1945 until we became NIMHANS in 1974. And there are more than 37,000 files in this particular archive. The repository structure includes the digitization of case files, registers, artifacts, newspaper clippings, photographs, and of course, various kinds of psychiatric and neurological disorders, as well as medical disorders, have also been put in. And the source materials have a content delivery system which consists of images. We have the original files which have been retrieved, scanned, and converted into PDFs and uploaded. And the case files are available and they can be searched depending upon certain keywords to search for them. And the current configuration also helps to maintain confidentiality and complies with ethical standards as well. And this is the data flow. And there is a database server which helps us to maintain all of this data in a confidential manner. In terms of future directions and insights, I think the repository will help to enable further historical studies in psychiatry, neurology, as well as public health. And there can be interdisciplinary research. It's a very good training resource. And again, many hospitals have such information which they need to digitize and archive in a systematic manner. And future expansion will, of course, involve user-friendly, ethically designed access systems. So, in terms of schemes of a larger kind, there is a proposal. We are working on a NIMHANS Museum of the Brain and Mind, which integrates not only the history, but also the current understanding of the brain and mind, and perhaps looking at technology and developing futuristic models. The faculty group has enlarged. Dr. Jaisurya, Dr. Ajit, Dr. Chetan have also been involved in the digital archives. We've been assisting other institutions in archiving, and learning from their histories is also very important. And of course, it's not just institutional history, but also the development of psychiatry in the community, in different parts of the country, the kind of understanding about stigma as it evolves, access to care as it evolves, and really to see whether anything has changed from what was described by the early psychiatrists of a very large treatment gap. Whether we've really been able to do anything about the treatment gap remains to be seen. I wanted to apologize for all the glitches. Again, not my doing. Nature at its best, but then it brought down the temperature. So I'm very grateful. Of course, I hold the nature responsible for these glitches, but I hope it wasn't too interrupted. Thank you very much. Over to you.
Thanks a lot, ma'am. Thanks a lot. I thank both the speakers, Dr. Sanjeev Jain sir, for the insightful and comprehensive overview on the breadth and depth of psychiatric history in India, especially in the British era and beyond. I also thank Pratima Murthy ma'am for the personal and practical insights and for forward-looking insights on how to archive and how to go about it. For the want of time, I'll just open the house for 2 or 3 comments or questions, please.
If Alok Sarin sir wants to talk anything which we have missed out or anybody has missed out, sir, would you like to say something?
No, thanks. I think it's been very comprehensive, both from Sanjeev and Pratima. And so there's really nothing that I need to say. Thanks, Sanjeev. Thanks, Pratima. Thank you to the IPS members and the office bearers for organizing what is actually a very useful session. So nothing specifically that I would like to add. Thank you very much.
Thank you, sir. I mean, I was just thinking, despite the interruptions by the nature and the fury of the rains in the Mysore and this part of Karnataka, I think it really went well. Madam did not give up despite so many hurdles. Madam, thank you so much. And all the gaps in the history are vividly recorded, I believe, in your presentation. And if there are any questions or suggestions, you people can take it, or we can close the recording.
Sir, if I may, if there is not any question, if I can ask a question.
Please.
To both of the speakers. What can a undergraduate or a postgraduate student do on his or her own part in archiving of the psychiatry records? Ma'am and sir.
Yeah, I mean, I think there's tremendous lot that people can do. And I think one mustn't think of especially at the undergraduate level, or, one mustn't think of archiving as, as this big, huge thing. Just sitting down, and that's exactly what I did. I mean, I just went back to old records, and at that point in time, we did not have any technology. So it meant actually writing down all the criminal, patients, I think about 800 or something like that, writing down all of those details, putting them, transcribing them onto a computer. But it's fascinating. And I think developing an interest in history is the first and foremost thing. Young students can also read about archival material. I mean, if they don't have to, but I think dirtying your hands is a fantastic thing to do. You really get a sense and feel for the records, for, the importance of preservation of records, for understanding and interpreting information. So I think it's a very, very important thing for undergrads and postgrads to be involved in it. And of course, nowadays, you do have readily available archives. So in that sense, you're looking at secondary data analysis and understanding. So I'm sure those will also have their, they'll be worth it. I remember Sanjeev, and maybe Sanjeev will talk about it. There are researchers who actually came to our archives to study them. One was on, women and mental health, the related issues, so gender aspects of mental disorders. And just as we speak, there's another person who's just come in, who's doing her PhD, trying to understand, it from various kinds of anthropological and other, dimensions and other lenses. So it's very, very useful for a whole lot of people. Sanjeev, over to you.
Yeah, I think the first thing is to actually talk to patients. Patients often have family members who have been treated. So one of the most important things was one elderly patient who I saw, who was much older than me. This is when I was a young faculty, who had brought his grandmother to the mental hospital for treatment when he was a little boy. And he remembered the campus as it was. So it's a living history, how patients have treated their own grandparents, their own members in the family. That's a living history. And from there you start developing who were the doctors who saw you, who are the doctors who went on. So even in Bangalore, I could interview somebody who had been seen by Vidyasagar, who had been by S.S. Jairam, who had been seen by all the names, by Govind Swami, whose leucotomy had been done by G.N.N. Reddy. So just tracking patients' lives through the various processes, it's a very important resource. Now, if the IPS For example, if you guys want to do it, if we work together, we can put together a list of all the archival information relative to psychiatry in India that is available on the web in all the universities of the world, in all the repositories of the world, and within India itself. It will take a lot of time, but lot many researchers can just sit and browse through case notes or administrative files as to why was a hospital built in a particular place, what happened to the Tezpur hospital, what happened to the building of Lahore hospital, what happened to the Bareilly hospital. So all these little details can be, it's an endless source of fascination. So starting out on this is very easy, but to really get your hands dirty, talking to patients and families and to the senior colleagues. I remember going and interviewing Professor Dr. S.S. Jairam, who was the only person who had worked in the old mental hospital campus in Bangalore in the 1940s, and then in in the 50s here, and then was spending his time between America and India, as to how psychiatry was like in the 40s in America, in the 50s in America. So it's a very real connection that we get. And, so tracking families, tracking people is the best way. And so getting the state government archives are very good, but it requires a lot of patience to go through them. And states like Punjab or Bengal, the records are distributed. But states like Tamil Nadu and Maharashtra have got excellent records of so getting this is not very difficult. And hopefully with this digital archive, which Nimans has put up, if you can encourage people to actually look at this in more detail for whatever things, it will be very interesting. I mean, it's a constant source of knowledge.
And Sanjeev,
Yes.
if I can just add, in terms of the phenomenology and the early case notes, the richness of early case notes simply cannot be matched. And this is a constant kind of discussion that as technology advances and we kind of make all our records online and terribly brief, we lose a lot of the richness of the information which is available in the archives. So I think reading all of that actually will encourage my spirit of inquiry among students to really explore their patients' psychological status much more.
No, it also humanizes the whole practice of psychiatry to find that a particular person on a particular street came to the hospital, and if you drive down that street, you'll still see the same surname on the same street. So it's a living history. It's a living history of our community, of our society, and the whole. So unless we give back the humanity to the psychiatry, literally the human touch, that these are human beings who we treated. This is not just a case of 295 or whatever, 0.1 or F20 point what. It was actually Mr. So-and-so from this street. So that it humanizes psychiatry. Like we all know, the purpose of history is to humanize people. We can think of Gandhi as a person, but to see Gandhi writing about, in one of his speeches, he says, the politicians need to be like doctors of a mental hospital, who by their kind words can change people's minds. We should be able to do that. Now, there was a time when psychiatry did not have the stigma among the political class. Gandhi was looking up to psychiatrists, which is very different from usko pagal khane bhej do aaj. That time, mental hospitals had a different meaning. To see how we lost that aura of psychiatrists being the valued member of society is also a historical process.
And I think even Govind Swami says that very well, that you don't look at a patient as, a specimen in a container, but you look at them as living, thinking, feeling people in an environment which is constantly kind of influencing them. So I think even understanding psychiatry in that way is so important.
I think when you started the proceedings, you mentioned that having a sense of history for the profession is very, very important. And a sense of history for the professions is one thing, but having a sense of the history of the people who were seen by the profession is a mirror to that. So if you retain the history of our patients, then we are more sure of our own history. So therefore, we should really try to document the histories of the patients as much as we do it for the profession. And that is doable. We have so many hospitals, we have so many psychiatrists, we have so many people at different age spectrums. Just documenting the lived histories of the psychiatrists who are now in their 80s would be a start. What were the kinds of patients they saw? How did they work in the first few years after antipsychotics came in the 50s and 60s? And there are people around from that era. So it's a very worthwhile enterprise for the IPS to do, even documenting its own membership.
I think that's a great idea. I mean, if every undergraduate or young postgraduate could actually do a narrative history with one of the seniors in their own societies.
Yeah, that would be a wonderful archive.
Just as an initiative would be a great one. Yeah. And that could be presented at the next Psychiatry Society meeting.
So
this could be like a group workshop,
Yeah,
it could be like a group workshop.
Definitely, so we can take
Kishore
up that
and
suggestion.
all of you. Yeah, I think straight away there's an idea that you can take up.
Yes, ma'am. Definitely, that's a very good idea that we can take up for the next meeting whenever we have it.
Yes, ma'am.
Yeah, and by the faculty also, we can encourage them to have periodic quizzes program on this theme for undergraduates and postgraduates. Once we introduce them in the quiz format also, there will be a lot of interest. And since this document, which will now be available in the YouTube channel, there will be some way for people to access and reflect and add on to it. I think that would be a great idea. We will also put across to the faculty to consider it and see how to engage undergraduates and postgraduates. I think Priya Jain will also be able to put it through the Minds newsletter and connect to the medical students across India.
Sure, sir.
Yeah.
Yes, sir. That is a great idea, sir. And there are no more questions, and we are way past all the time because of the
Just one small thing.
well discussion.
Make it a point to interview the oldest patients you have, what they feel about psychiatry. That's all.
Yes, sir. Definitely, sir. I have noted this down, and I will encourage my own colleagues and whoever I can for all this. Thank you. Thanks a lot, sir. So I think we can close this session I think overall we all have been reminded today that while the historical records in psychiatry are very rich from India, they still remain vulnerable and unless we consciously try and preserve them. Understanding what exists is only the first step. Building systems to archive and sustain this legacy is equally essential. I hope this session serves as a starting point for a more structured efforts in archiving the history of psychiatry in India. With this, I proceed to a formal vote of thanks. First and foremost, I sincerely thank our chief guest and resource persons for the day, Dr. Sanjeev Jain, sir, former senior professor of NIMHANS, Dr. Pratima Murthy, ma'am, ex-director and senior professor at NIMHANS. I also thank Dr. Mohan Isaac, sir, and Dr. Alok Sareen, sir, for being present here. I thank the IPS body and office bearers, Dr. TSS Rao, President IPS, Dr. OP Singh, by the President-elect IPS, Dr. Arun Marwale, Honorary General Secretary, Dr. Lakshmi Naresh Vadlamani, Honorary Treasurer, Dr. Sujit Sarkhel, Editor of Indian Journal of Psychiatry, Dr. M. Kishore, Chairperson of the IPS Faculty Development Subcommittee, members of the ITAP, all faculty members from various institutions, my fellow co-moderator, Dr. Priyesh Jain, and all the respected participants to join our session. And not the least, our supporters for this session, Psychiatry for You, Center for Health Information and Minds United for Health Sciences and Humanity Trust. Thank you, and may you have a good night. Thank you. We'll close the session here. Thanks a lot, sir.
Thank you, Dr. Bhavnish.